Update now. People around the world are marveling at the size of 16-pound Longview newborn Jamichael Brown. But his weight is also shining a light on a disturbing trend. CBS 19's Amanda Robertson joins us with more on the dangers associated with overweight birth. Amanda?
Michelle, there is some good news tonight. Jamichael Brown is breathing on his own and has been moved out of the neonatal intensive care unit and into normal pediatric care. But doctors are still monitoring his blood sugar levels because, like many babies born to mothers diagnosed with gestational diabetes, health complications can still arise.
We've seen babies that have what we call macrosomia, which they're large for their gestational age. Typically, these babies are approaching 10 pounds or more.
Pediatric endocrinologist Dr. Juan Casas says Jamichael Brown and his mother Janet are not alone when it comes to big births.
It's more common lately because we have more gestational diabetes, more overweight mothers having babies.
Gestational diabetes is one of the most common health problems for pregnant women. If not controlled, it spikes the woman's blood sugar level.
That causes the stimulation of insulin growth factors, growth hormones, a lot of these different hormones that cause the baby to grow very rapidly.
But once the baby's born, mom isn't out of the woods.
Mothers who have gestational diabetes who did not have diabetes prior to pregnancy are at much higher risk of having type 2 diabetes later in life.
She's not alone. The baby also faces potential health issues in the future.
They're born with larger organs, larger livers, can have very large hearts. All of these things can compromise their circulation, their respiration.
These complications also increase the baby's risk of hypoglycemia and obesity as they grow. But no matter the health risks, Dr. Casas says there's one thing every expectant mother needs to do.
Should be followed closely by their OB to be monitoring blood sugars, be monitoring the size of the baby, because sometimes that could be dangerous to the mother if the baby's too large during the birth.
Dr. Casas says parents who have babies born at risk of diabetic complications need to consistently watch their diet and stay in touch with their pediatrician. Michelle, so far, Jamichael has not been diagnosed with any medical complications. No word yet on when he will get to go home.
All right, well, we wish him well. Thank you so much, Amanda.